The Bubonic Plague. I'm going to start off with a quote from Giovanni Boccaccio, which I'm sure we've all heard before. Victims ate lunch with their friends and dinner with their ancestors in paradise. In reference to the plague, because it killed people incredibly quickly. So what is the Black Death? The plague? It's a bacterial infection caused by Yersinia pestis. The origin was in China in approximately 1330. That started the infamous epidemic in the 14th century. China was trading with Italy, and the Italian sailors that went to China brought it back to Italy, and then it spread all over Europe. And during the epidemic in the 14th century, it was believed to have killed 30 million people in Europe. That's not even counting the people in China or Africa. If left untreated, it has a death rate of approximately 30 to 60%. Okay, so a little background information on the Y. pestis bacteria. It's a gram-negative bacteria that is rod-shaped, as you'll see in a couple of slides. Once it enters the bloodstream, it usually finds a lymph node, and it'll just sit in there and reproduce. And if you don't get treatment right away, it'll eventually spread to the rest of the body. Y. pestis secretes Yersinia bactin, YBT, that it will release and it will go scavenge iron molecules from the host in the red blood cells, and it'll bring these iron molecules back to the bacteria and reattach to the bacteria to bring it iron. This is very important because if the bacteria doesn't get the iron, it will not be able to form the first colonization and be able to keep up with its reproduction. And it has quite an impressive evasion system, which is probably why it killed a lot of people. It has YSC proteins that create the secretory organelles, such as the Yersinia bactin that I just mentioned. It also has YAP effectors. There's a couple different ones. YAP-H inhibits pro-inflammatory signaling. YAP-A and E disrupt actin filaments. YAP-M interferes with cell cycle. YAP-J inhibits MAPK and NF-kappa B signaling pathways, which all basically help prevent the bacteria from being phagocytosed. Factor 1 and LCRV, in this bacteria at least, increase the resistance to phagocytosis. And also, backtrack a little bit to YAP-J, the NF-kappa B signaling pathway is basically, it interferes with that, which basically has to do with macrophages. It causes the macrophage to undergo suicide so it can't eat the bacteria. So transmission. Plague is usually transmitted by a flea bite. And the flea has to get infected by a rat first. So the rats are the primary carriers of the disease. The flea bites the rat. The flea gets infected. The flea bites the person is infected. Basically, that's it. Or if the person comes into contact with bodily fluids of someone else who's infected, like if they touch one of the sores and they have a cut on their hand, or infectious droplets that have to do with the pneumonic plague that I'll talk about in a second. So symptoms of plague depends on the route of exposure. A person will start exhibiting symptoms after about 3 to 7 days after they're infected, and it's usually flu-like symptoms that they'll start experiencing. Now, there's 3 different types of how the plague can go here. You have the bubonic plague, which is basically the most common one, which it has headache, chills, weakness, and swollen lymph nodes, which is what you generally think about when you think about plague, is the lumps, which are called bubo, hence bubonic plague. There's septicemic plague, which is when the bacteria are traveling in the bloodstream, such as if you touched one of the buboes with your hand or whatever, and it got into your blood. And this results in the blackening and death of tissues, which you'll see many plague patients will have. Like their fingers will turn black, gangrene basically. And then you have pneumonic plague, which is rapid pneumonia forming in the lungs, chest pain, cough, bloody mucus, etc. And if bubonic plague goes untreated for long enough, it can turn into either one of these or both. And if it turns into both of these, you're basically screwed. But it usually just likes to stay in the lymph node. But if it doesn't get the treatment, like I mentioned, it'll spread and turn into one of these. Now, interestingly, bubonic plague you can't get that from another person. You have to be bitten by a flea. Pneumonic plague, to just get that by itself, you have to ingest like droplets from the cough. And like I said, they like to stay in the lymph node. So, okay, diagnosis. How do we diagnose the plague? Basically, you give a sample of blood or fluid from one of the abscesses, the buboes, and it gets analyzed in a laboratory. Or they have a dipstick, which I think they're still developing. This is for use in third world countries when you can't use a lab. And it's basically, I guess, kind of like the same technology as a pregnancy test. You basically dip it in like a sample and it tells you if there's plague bacteria in it. And this picture is basically just a colony of the Y. pestis bacteria, which are rod-shaped, as you can see. Treatment. Treatment for the plague is usually a round of antibiotics, which can be streptomycin, gentamicin, tetracyclines, or chloramphenicol. And they've also had prophylactics, a vaccine. They tried a vaccine, but it isn't 100% effective, and it has all these side effects like painful inflammation, and you have to go back for like a whole bunch of them, like a booster shot, and it just wasn't. I mean, it kind of worked, but not enough. If you're going into a plague-infected area, you should probably get it, but yeah. So plague today, is it still around today? Yes, it is. Most of the cases are found in parts of Africa. There's a little map under here. This is a little bit outdated from the CDC website. 2000, 2009, but you can see most of the cases come from Africa, and there's a little bit in China, Asia, and smack dab in the middle of the United States. 10 to 15 cases per year. In 2006, there were a lot of cases for some strange reason. Mostly in the western United States because the Y. pestis bacteria is usually found in rural areas, which are mostly out west, so that it probably explains why. And here are my references, and that is it.